Hello and a very warm welcome to this topic-based education session for patients and professionals. This evening's topic is taste disturbance. I'm Mags Robinson, Support and Information Officer for Fifth Sense, the charity for people affected by smell and taste disorders. With me today are my colleagues Sally Connick, Helen Rhodes and Sarah Pearce. They will be in the background making sure everything runs smoothly tonight. It's my pleasure to welcome our guest speakers, Professor Prof Philpott, Sheri Taylor, Deborah Howland and Joe Olliver. Carl is a consultant ENT surgeon, a Fifth Sense Trustee and our Director of Research and Medical Affairs. He is Professor of Rhinology and Olfactology at the University of East Anglia, where he leads a number of research projects related to smell and taste disorders. And he runs the Smell and Taste Clinic at James Paget University Hospital in Great Yarmouth. Sheri is a registered dietitian. She is Director of Specialist Nutrition Rehab, which she set up in 2016 to help people after major trauma, including traumatic brain injury, to maximise their health through nutrition. Deborah is a specialist dietitian in the Department of Nutrition and Dietetics at Torbay Hospital in Torquay, where she runs a taste clinic. Most of her patients are living with the symptoms and side effects of cancer and cancer treatments. It's the first taste clinic in the UK. Jo is a Fifth Sense member and volunteer. She will be our expert patient this evening. She's been living with taste disturbance for almost exactly 2 years now. Thank you all for joining us. There's just a little housekeeping before we dive into our topic for this evening. First, some background to the event. Most of our events focus on smell disorders. So having recognised that more people were coming to us for support and information around taste loss distortion only, we set out to run an event on true taste disturbance. This is where a person's ability to taste food is compromised while their sense of smell is unaffected. It's extremely rare. Although most people are aware that smell and taste are closely linked, there is still much we can all learn about this. And that's why we call this event Towards an Understanding of Taste Disturbance. As Carl will explain, many people who believe they have a problem with their sense of taste, in fact, have a smell disorder. We want to help everyone affected by taste changes and those supporting them to gain a better understanding of the link between smell and taste and flavour perception. Also, the experts we've spoken to have confirmed that the knowledge base around taste disturbance, our understanding of the mechanisms involved and what can be done to support the health and well-being of those affected is still in its infancy compared to the other senses, hearing, sight, and smell. Whether the underlying cause is a true taste disorder or a smell disorder, the impact on those affected is huge. So we want to start a conversation, galvanise action around the topic of taste, and with a view to improving everyone's understanding of taste disturbance. We're proud and excited to be hosting this event on this important topic for both patients and professionals. As far as we're aware, it's a world first, this event. So the event is being recorded. Please make sure you are muted throughout. If you have any technical difficulties, please private message Sally, Sarah and Helen from the Fifth Sense in the chat. They'll be dropping links into the chat as we go and they'll be happy to help. The event will be split into 3 parts. First, we'll hear from our expert patient Jo, who will share her personal story of living with taste disturbance. Then our expert speakers will each give their presentations. Carl will talk about the anatomy of taste and how smell and taste work together to create flavour, some of the common causes of true taste disturbance, how patients who present to his clinic with taste disturbance are diagnosed and managed, and some potential areas for research. Then, drawing on the expertise they've gained from working to help the people they support, our 2 registered dietitians, Sheri and Deborah, will talk about the importance of good nutrition and hydration, the challenges and specific risks to health that their patients face, and they'll share some specific interventions and practical suggestions to help improve the quality of life of those affected. Please feel free to drop comments into the chat box during the presentations. You may also drop questions for all 3 expert speakers into the chat. I'll ask the questions of them on your behalf after they've all spoken. And please note our expert speakers cannot give individual medical advice. Please mark your questions with a Q so we can spot them easily. And it would be helpful too if you would indicate if your question is to be directed to a specific expert. After that, there'll be a Q&A, and after the Q&A, we'll ask you to complete a simple survey so you can give us your feedback on the event. So I'd like to speak to Jo Olliver now, and thank you for talking today, Jo. So tell us about your experience of the taste disturbance that you've been living with over the last 2 years and the medical care you've received over that time. Thank you.
I caught COVID in November 22. So it's as Meg said, exactly 2 years. And I was left with a terrible salt, sweet, metallic taste that I couldn't shake off. And my GP gave me some nasal drops, but nothing else. So I eventually just stopped eating. Food tasted so terrible that I just couldn't stomach or face eating food at all. It was over the Christmas New Year period, so it was quite difficult. And by February, I'd lost 2 stone in weight, went back to my GP, who was a bit more attentive and said, well, I'll put you on a fast track cancer course to see whether they can see if there's any treatment or if there's anything they can find. And they did all the usual tests and scans, but actually there was nothing, thank goodness. I came back completely clear. And then I saw 3 ENT specialists throughout 2023. Nothing at all, just simply, well, if it's COVID related, it might go away or it might not. But they couldn't offer anything better than that, except for one consultant who did say, try talking to Fifth Sense. They might be able to support you and they have research. So I'm really grateful for that. But that was really the only healthcare that I received during that time. And it produced nothing at the end of it.
Thank you, Jo. And can you talk us through your symptoms and their impact on your quality of life?
Well, the symptoms sort of evolved over time. The salt, sweet taste remains. That has never gone away. I developed a sort of burning mouth pain and dry mouth, but the taste was still distorted. That didn't change. Interestingly, I didn't ever lose my sense of smell, or at least I don't think I did, because everything smelt the same before and still does. I cook. I enjoy preparing food, making food. I just can't eat food.
Thank you. And you did mention that you had a dietitian who gave you some advice.
I did. I had a dietitian on the NHS who was quite helpful, suggested that I tried all manner of different types of foodstuffs, but the food, it was so horrible. The taste was and still is so horrible that in the end we came to the compromise, if you like, that I would just try Fortisip protein and fibre drinks and water, a lot of water. And I've stayed with that ever since. And that's been my diet for the last 2 years.
And can you cast your mind back to before you were prescribed the Fortisip, when you were losing weight and you just had to eat? What was it about trying to eat that was difficult for you? Are you able to describe that?
Well, the mouthfeel of food was horrible. I mean, that was just awful. And I suspect that was to do with the dry mouth and the burning mouth. But then underlying that, the actual taste, because I can't tell whether it's taste or flavour, and I'm sure I'll learn about that this evening. But I can tell you what the food is if I try it, but it's too horrible to keep in my mouth. And that's the same whether it's drinks or solid food, really. In fact,
Yes.
drinks are probably worse because anything hot is very painful because of the burning mouth, I suspect.
Yes, thank you. And you've said before, it's very difficult to describe the subtleties, that we haven't got the language around describing taste. It's very difficult to do that.
That's the thing, isn't it? I mean, you know something tastes disgusting or it feels bad in your mouth, but to try and get that across to a healthcare professional is very difficult. Even to a dietitian, it's not an easy thing to get across.
Okay. So, I mean, you mentioned that you've been surviving almost exclusively on Fortisip and water for the last 2 years, and yet you've remained in good health. Do you have any tips for others who are experiencing similar symptoms? And what advice would you give them to help them manage their physical and mental health?
Well, I'm amazed that I have remained as healthy as I have. I really have been well throughout the 2 years, and which is extraordinary. I haven't had colds, I haven't had family have caught things, and I haven't caught them off them. I don't know what that says about the protein drinks and the fiber drinks, or about me, in fact. But I mean, the one thing I would say to anybody out there that's got a taste disorder is to keep socializing. I mean, it is important to stick with it. I still go out with friends. I mean, I don't go out for a special meal. That would be crazy. But I will still go out for a get together. And I'll just simply say, I'm not eating at the moment and leave it at that, really. And it's no problem at all. And I think, I know it can be a bit intimidating because you think, oh, well, I've got to explain myself. But actually, people have so many dietary issues these days that I just say I'm not eating and that's fine. Nobody wants that.
Okay. That's wonderful. Yeah. So, and for someone like yourself who enjoys cooking a lot, because you've not spoken much about that because of time, but I know you really enjoy cooking and you still cook for your family as well, don't you?
Yeah.
Yeah.
Yeah, I cook every day. I cook for my husband. I cook for family and friends. Got Christmas coming up. I'll happily cook a Christmas meal. I just can't eat it with them. That's basically the situation.
Okay. Thank you. That's been really helpful. One thing, when you and I were preparing for this event, you took a delivery of Fortisip on your prescription, and it was 17 kilograms for the month. And you made a point then that really stuck with me. You said, if I lived alone and someone visited me, it'd be an empty fridge and cupboards full of nothing but Fortisip. And that's a stark image, those cupboards devoid of everything except Fortisip, especially when we know how much you enjoy cooking and how much you'd like your sense of taste to be normal again. And that's what stuck with me. You said, I can live on them. I probably shouldn't, and I dearly love not to. And another thing you said is, I'd rather be an expert in something else other than taste disturbance. So that's what I hope healthcare professionals and people who are other people who are supporting people who are living with taste disturbance will remember. So thank you, Joan.
Thank you.
Okay. So without further ado, we'll move on to Carl. We want to stick to time this evening. So I'll hand over to Carl. Thank you.
Thank you very much. Right, let me share my slides. Okay, hopefully you can all see that. Good. Right. Well, thank you very much for the preceding talk. It's really important to hear the real story, and obviously always disappointed to hear about the doctor's shrug, because that's another thing that we need to do through Fifth Sense to try and sort of get more of our medical colleagues to kind of take these things seriously. Anyway, I won't beat around the bush. The slides aren't advancing. Oh, there we go. Right. So I'm going to sort of talk you through the anatomy of taste and separating taste from smell. I will talk about the cause of true taste disorders and some tips on management. So taste, or gustation, as we might refer to it medically, is 5 core modalities: salt, sweet, sour, bitter, and umami. Now, umami is not something that we recognize so well in Western culture. As the name suggests, it comes from Southeast Asian culture. And because of its kind of relatively poor recognition in Western culture, we don't normally test for it, as I'll talk about later. and a colleague of mine in Geneva did a study a few years ago where he asked people in the local population to take some monosodium glutamate, put it in their mouth, which gives an umami sensation, and to write down what they thought the description of the taste was. And he had 40 different words in his test. So that tells you a story about umami. Now, there is some early scientific evidence suggests we might also be able to taste water, fat, and also metallic. And for those of you who may have ever cut your finger and sort of sucked on your finger afterwards, maybe you had a metallic taste perhaps of the iron in the hemoglobin that's in the blood. Now, when I talk to medical students, I show them this picture and I tell them that if they see this picture in the book, they have my permission to rip it out because it's absolute rubbish, but it's an old myth that still pervades. Actually, the reality is that the areas highlighted are the areas you can taste on your tongue, and you can taste all of those things on those areas of the tongue because that's where taste buds exist. Now, the little bobbles you can see on the picture there, if you stick your tongue out and looking in the mirror, are not the taste buds, they're the papillae. And the little highlighted diagram in the middle here shows you the side of the papillae. So the papillae have little pits in the side of them, and those fill with saliva. And in the side of the pits are the taste buds, these little bits here. And the taste buds therefore soak up the tastants that are in the saliva in the mouth for you to be able to kind of contact the receptors. So these are the increased zones of sensitivity. Now we have taste buds on the tongue, but we also have them in other parts of the mouth and the throat as well. Now, the reason we can detect all those tastes with any of those parts that are highlighted is because a taste bud looks like this, and it contains all those receptor cells within a bud to be able to just pick up those 5 taste modalities. And if you look at them in kind of molecular terms, these are kind of the structures, and you can see that A and B, which are sweet and umami, share similar structures in terms of their configuration, whereas C, D, and E are sort of different, although C and E have some similarities. So there is this kind of sort of relative crossover in terms of the receptor configuration. And that's really just sort of highlighting the sort of things that stimulate those receptors. So obviously umami is the monosodium glutamate, also L-glutamate here. Sweet, obviously sugars of different forms. The bitter, various things such as saccharin, and bitter things are often in foods, and bitter stuff actually often are higher in foods that may be harmful to us. So it's often there as a protective mechanism. Obviously salt is salt, and various kind of salts that can occur. And then we've got sort of the citric acids and tartaric acids that can stimulate the sour sensations. So I mentioned already there are these various types of papillae that occur. Not all papillae contain taste buds, so 3 out of the 4 papillae types contain taste buds. And they're not just on the tongue, as mentioned. You can find them on things like the epiglottis, which is a bit of your anatomy that folds over your windpipe when you swallow. The top of the esophagus, which is the kind of gullet, and even some in the nose, perhaps. Now, taste is wired by things called cranial nerves. And so for taste, we have 3 pairs of cranial nerves, so 3 on each side. So the taste buds at the front of the tongue feed into the 7th cranial nerve, which is the facial nerve. The back third of the tongue is supplied by the glossopharyngeal nerve, which goes separately. And then we've got the vagus nerve, which supplies the bits that are not on the tongue. So for this reason, taste actually is less vulnerable to damage because we've got more nerves supplying it. And that's why, as you'll see, it's much less common than a smell disorder. Those connections then wire up to different parts of the brain, and the areas of brain they end up in are right adjacent to the smell areas. So it's an area called the orbital frontal cortex, which is at the front of the brain here and actually sits above the smell structures called the olfactory bulbs. And obviously you can see that from one side of the tongue, you get connections that go to both sides of the brain. So we get sort of a contralateral, as we call it, sort of spread of the nerve connections. So in practice, when we're eating food, we smell and taste together. And also because we use the word taste in English language to refer to enjoyment or flavour in food, this gets really confusing. And this is where everyone falls down. And it's not just patients, it's medics. excuse me. So everyone gets things muddled up. And this is a good example. People talk about the sweet smell of vanilla. Vanilla isn't a sweet smell, but inevitably, every time you've probably eaten vanilla, you've had it in something sweet. So perceptually, if you always have a vanilla with something that's sweet in it, you will associate that thing in your mind as a sweet sensation. But of course, vanilla itself is not a sweet smell. The taste of the sugar you have at the same time is the thing that's sweet. And here's another good example. This is a coffee tasting wheel I found online. And if we think about taste in this true sense, actually, I don't think apart from the sweet floral bit, any of the other taste senses mentioned here, all those things on there are smell sensations. And they're all the things that you would get from sort of smelling perhaps coffee beans or smelling the coffee in the cup underneath your nose, but they aren't actually the taste of it, because pretty much coffee is bitter taste. So this misperception is kind of, generic in the world around us and how we use it in language. And it's a lot of Western cultures. I see that in sort of, going to talk in other countries. There are some cultures such as in Amazon tribes in South America that have much better kind of words for describing separation between smell and taste, but we're not very good at it in European languages. So what is actually happening? Why do we get confused? Well, the reality is that you can see on this diagram that you've got the arrow pointing in the front of the nose there. So when we smell things from the outside, we smell through what's called orthonasal olfaction, and the molecules in the air go straight up to the smell receptors, and we detect those smells. When we put food inside our mouth, we're basically kind of dissolving stuff on the tongue, so we get the taste of it, which is the 5 things we just talked about. But also at the same time, the smell of the food circulates through the back of the nose into the smell receptors that way, and we breathe out the smell at the same time. The 2 things happen in parallel. So because they happen in parallel, it's hard to separate them, but actually a large component of what we appreciate as the flavor of food is that smell sensation. And that's what we call retronasal olfaction or retronasal smell. And so that's a large kind of component of what we're appreciating when we eat food. So be able to put a big piece of meat in our mouth, for instance, and we might get some saltiness or some umami from it. But actually to know whether it's chicken or beef or pork actually is the smell of it that tells us that. And the same with all the herbs and spices. So the taste bit is obviously the bit that's happening here, and it's those 5 sensations. And you can see actually, if you look at the right-hand side of the picture compared to the left-hand side of the picture, when we're eating food, we're not only kind of smelling and tasting, we're also seeing the food on the plate, we're seeing the color of it. When we put it inside our mouth, we get the texture of it. If we bite into it, we might get crunching. There's an audible component to it. There might be an audible component in a glass of sort of sparkling wine, for instance. So we've got all these kind of multi-sensory things happening. And you can see, therefore, how the brain lights up when we eat, because we're actually using all 5 senses together. And that's why actually, in normal good health, we actually enjoy food, because it's a very pleasurable experience that uses a lot of our brain. So flavor perception is this kind of overlap, but particularly between smell, taste, and also touch. And you can see, therefore, this is going to summarize what I've said already, which is bringing all those different things together in this kind of multi-sensory aspect. So, for instance, chili peppers give us a heat sensation, not a temperature heat, it's a kind of spicy heat. That's a trigeminal nerve mediated sensation. We obviously do get temperature sensation from different sort of temperature receptors, so whether things are hot or cold. We get all these different types of texture sensation, pain sensation, as well as the smell, the taste, the sound, all these anticipatory things that happen. So what happens in reality when patients come to see me in a smell and taste clinic? Well, the reality is that how patients perceive smell and taste problems and how they actually perform on testing, as demonstrated nicely by this graph, are 2 very different things. So if you look at the left-hand pie chart, you can see that this is a kind of summary of presentations to a smell and taste clinic as described by the patient. So we've got a large part of the pie chart here being smell and taste loss. We've got 20% saying smell loss only, and then we've got 10% with disturbances in smell and taste, so distortions, what we call qualitative disturbances, and then the 8% saying taste loss only. We actually test patients nearly 70% actually only have a smell problem. Only less than 1% have a true taste disorder. And so there's this kind of significant mismatch, and that's why testing patients is so important. This is data from my clinic, and we've been running the clinic now for 14 years. So you can see by far and away, the biggest hitter is complete loss of smell, over 1,000 patients when we did this kind of data check. Compare that to complete loss of taste is probably about 20 patients, 20, 30 patients maybe that have had complete loss of taste. It usually is it's about 1 in 100 patients that we see. Now there has been some increase in that since COVID, but we can come back to that. So the testing we do is really important. So the main bit of taste testing we do is what we call a taste strips test. And you can see a little picture there of me and Jane, our research nurse, sort of placing the taste strips on the tongue. So we have a little bit of software that runs the test, and it basically alternates between left and right side of the tongue, and it kind of cycles through different concentrations of the 4 basic tastants. And it gives us a score out of 32. A score of 20 or over is considered normal. A score between 20 and 10 is considered kind of reduced, and anything under 10 is considered completely agusic or no sense of taste. But the other thing we look at the test is whether there's any asymmetry, because obviously there's a difference between the 2 sides that suggests there may be a one-sided problem that may be relevant to the cause of the problem. Also, the other bit on there is just to show you that we have a test called a retronasal test, which if we do taste and smell testing on, there seems to be a mismatch between what we do with the orthonasal smell testing and how patients perceive flavour despite having a normal taste test. That's another way of actually mimicking how patients appreciate the flavour of smells when they're inside the mouth. So we put powders on the tongue. But the key bit of information often is the smell test, and this is the test we use called the sniffing sticks, which tests what we call threshold. So this is kind of the basically one smell in the set, and we go through different concentrations of the odour till people detect or determine a threshold. We measure discrimination, so it's picking the odd one out from 3 pens, with one being different from the other 2. And identification, which is, as the name suggests, kind of, giving the right answer out of a choice of 4 options. Now, in reality, actually, when you look at how does smell loss have a bearing on taste, but also touch function through trigeminal nerves, is that we can see from different causes of smell loss that because of the cross-wiring in the brain, actually, if you have a reduced sense of smell, it can actually have an impact on your true sense of taste, even though the primary problem is actually with smell. So there is definitely some overlap, and it will depend on the cause. Now, if you look at patients who have a head injury, actually sometimes they may have injury to the brain that overlaps the smell and taste areas in the brain. So that's a case where there may be overlap between them both. So what are the causes of taste disorders? We can see direct nerve injuries. Those are things that ENT folk and dental folk might do as operations that have caused a problem with damaging the nerve. So the lingual nerve in the mouth with a dental procedure. Tonsillectomy can damage the glossopharyngeal nerve. Doing a procedure called a microlaryngoscopy, where we kind of put a rigid tube down to look at the voice box, can sometimes even cause injury to the vagal nerve or the glossopharyngeal nerve. So all those nerves can be damaged by surgical procedures. You might get injury to the nerve through paralysis, such as the facial nerve being affected by a stroke. Obviously head injury mentioned, and then various neurological diseases which may affect individual nerve pathways. We can see side effects from medications, so radio and chemotherapy being key ones, but also medication side effects, and I'll show you a slide about medications. Vitamin deficiencies and mineral deficiencies, so a few ones are mentioned there. And then we've got systemic diseases, so cancer can sometimes cause a sweet taste disturbance. And then we've got kidney problems, liver problems, diabetes, autoimmune conditions, and a thing called sarcoidosis, which is an autoimmune disorder. And then we've got infections, as our first speaker mentioned, sort of following in a viral infection. So obviously we've been seeing this with COVID. And then obviously the biggest group that we end up with actually is a group of patients for whom we find no cause at all. So as I said before, true taste disorders are rare because of the nerve innervation and many cases do turn out to be what we call idiopathic, so there's no apparent cause, but that is a matter of exclusion. So how do we manage patients that come to clinic? First bit obviously is the history, listen to the story, work out what's going on, try and unpick what's true taste, what's smell, whether it's a quantitative disturbance, so it's kind of a reduction in the amount people can smell and taste, or whether it's a qualitative disturbance, so is it a distortion of smell and or taste. Obviously to examine usually the nose and the mouth, and then we move on to the tests, which I've already mentioned. In select cases, we may choose to use scans. Scans aren't needed for everybody, but they may be in select cases. And then also blood tests, again, selectively for certain patients according to the presentation. And then we can break down sort of treatment into whether the problem's a quantitative one, in which case then we would give advice about dietary enhancement, which you're going to hear about in the latter talks, or we move on to looking at qualitative disturbances. Now, if there's a cause, we may be able to treat that, or we may have to treat the symptom on its own merit. Obviously, if there are medications causing the problem, and there is a huge amount of medications listed in the British National Formulary that have taste disturbance as a side effect, because basically when they do sort of early stage trials, if anyone mentions a taste disturbance during a clinical trial, it gets listed in there. So, as you can imagine, a lot of things can appear on this list, but there are some ones that are more common. You know, clarithromycin as an antibiotic is one I hear quite often. There's a nasal spray we use for allergic rhinitis called Dymista that sometimes has a bitter aftertaste. So the common sense thing here is often to sort of try removing or stopping the medication, and you know, usually if that's the cause of it, sort of stopping the medication will usually stop the problem. Treatments have been investigated in low quality studies, so not sort of in formal kind of full scale, what we call randomized trials, which is the gold standard. Include sucking ice cubes, applying local anesthetic, alpha lipoic acid and vitamin D. And as you can see, the first two have been tried for cases where we don't have a known cause for the problem. Antidepressants may have a role because there is a sort of, you know, overlap between depression and taste disturbances. And so that may be something to have a conversation with patients about. Some may already be taking antidepressants. And sometimes the medications we use to treat may have an antidepressant quality as well. So amitriptyline is one of those that I quite often use, and that obviously is primarily an antidepressant as a drug. Zinc gluconate is one that we has some limited evidence for. Is basically kind of a zinc. Sorry, it's a vitamin supplement that can be bought over the counter, and so relatively harmless in terms of side effect profile. And you know, is something that in some patients I recommend to try, depending on the potential cause. And then, as I mentioned already, if we really want to go sort of to the stage of trying to block the signal, then amitriptyline, gabapentin, and other anticonvulsants such as sodium valproate have a role. And then there's a conversation to have about this kind of, you know, the benefits plus the kind of, you know, potential sort of side effect disadvantages of using those medications. So in conclusion, hopefully I've kind of alluded to the separation between smell and taste, and how they get kind of mixed up and muddled up, and how they occur in parallel, and how we have to kind of test them to really understand kind of separating the two things out, and that true taste disorders are rare, but there are some options there for treatment. And that's me.
Thank you so much, Carl. Thank you. That's great. We did promise a little test, didn't we? The test.
Oh, yes.
But there's not much time for that. So what we'll do instead is describe that and send that after the call to people, because it's a useful thing that people can do on their own, really. Okay, thank you. So that's great. That we're getting some comments and questions in the chat. So we will refer to them in the Q&A at the end. And just to say that there will be a recording of this event uploaded onto our YouTube channel. There's so much content there, and what you've said, you know, I think I want to watch it again just to take all of that in, and I'm sure the same will be with the other two speakers as well. Yeah. So I'd like to hand over straight away to Sheri Taylor to talk for her talk now. Thank you, Sheri.
Great. Thank you so much. So I'm going to build on some of the information that Carl's already given us and try and focus a little bit more on practical strategy. So if you have an impaired sense of taste or impaired sense of smell, or the taste is distorted, what types of things would I recommend as a dietitian for some of my clients? Now, keep in mind, my clients are predominantly clients with brain injury. Some have orthopedic injuries in the facial region as well. So I can certainly focus on that experience, but I'm not saying that these strategies are going to work for everyone. Obviously, everyone's experience is different and the reason for your taste disturbance is quite unique. So you need to pick and choose through some of the different suggestions to see what might work best for you. So I want to focus on how taste disturbance changes eating habits based on my clinical experience. We're going to talk a bit about nutrition versus enjoyment. How can we get the best of both in your eating experience? And how can we focus on compensation strategies when taste has been impaired? So what I often see in clinic is that if there's been either a taste disturbance or a reduction in sense of smell, I will often see clients eating a lot of sugar and salt in their food. And sometimes actually these clients aren't even aware necessarily that their sense of taste or smell has been impaired. But when I see people on their food records saying they're having 3 teaspoons of sugar in every cup of tea or coffee, they're putting copious amounts of sugar on their cereal, that would flag up to me that I need to do a bit more investigation to see if there's some kind of taste or smell impairment going on. Many of my clients seem to have a bit of a why bother attitude when it comes to cooking. Why would I go to the effort of buying the food and cooking the food and cleaning up when I can't really get very much enjoyment from eating? And so some of my clients kind of are leaning more towards ready meals and takeaway, for example, which nutritionally makes them quite vulnerable, but also from a sensory perspective, sometimes those foods really aren't very helpful in terms of, you know, trigeminal properties and some of the things that Carl was mentioning earlier, and I'll expand a bit more on that later. As Joe mentioned at the beginning, certainly many of my clients start losing weight because they're like, well, why bother eating? I don't enjoy this, or I have a terrible taste every time I try. So why would I continue to persist with that? And those clients can become quite malnourished. But I also see the other extreme where clients are adding a lot of sugar to food. They're eating a lot of crunchy things, biscuits, fizzy drinks, etc., trying to get some kind of oral sensation and pleasure from their food. So that can have, cause their weight to increase. And finally, I find many of my clients try and pay very little attention to eating, which is not always as helpful as they might like it to be. So they'll spend a lot of meal times on their phone or watching TV. And what they're missing then is the sensory experience that is still there. So sometimes I will get them to occasionally, maybe not every time, but occasionally start paying attention. Well, can you taste the texture? Can you taste the temperature? What taste can you get from that? Are you getting any flavors or smells from it? What's still there that we can enhance perhaps in the future? So in terms of the concept of nutrition versus enjoyment of food and how can we get the best of both in your eating experience, I try and focus or explain the importance of nutrition with a bit of an analogy about a house. So if you think of your house, your body as a house, and inside this house is a 24-hour live-in renovation team, and our bodies and our houses are in a constant state of breaking things down and building things back up. Okay, so your renovation team is working all the time inside your house, which means that your renovation team always needs a constant supply of nutrient building blocks and supplies to repair just kind of day-to-day damage, or if there's a more serious injury that it needs to repair as well. So for that reason, a high intake of vegetables and fruit, protein-rich foods, omega-3 fats, calcium-rich foods, etc., are all really important so that your renovation team constantly has this continuous stream of essential building materials and supplies to repair any damage that's going on in the body. If for whatever reason we're missing one or more of those essential nutrients, then the repairs either can't happen at all, or they take a little bit longer to repair, or maybe the repairs don't happen to the same standard as we would like. So that's why the nutrition is important. But let's focus now on the enjoyment part of eating. And as Carl mentioned earlier, eating is a very multi-sensory experience. And if you've ever had the opportunity to eat at a Michelin star, a very high-end restaurant, you know that the level of effort they put into appealing to every single one of your senses. And so how I use this with my clients, because many of my clients, maybe their taste is impaired, maybe their smell is impaired, maybe they're also visually impaired, maybe the trigeminal nerves have been affected. There's many, many things that are sometimes going on simultaneously. So I try to use this as a basis to figure out, okay, which part still works? You know, which part can we really dial up? Which part can we enhance to really increase your enjoyment from food and eating? So think of it like a dial. Do we need to dial something up to give you more pleasure from it? Or do we need to dial something down if maybe a taste or a smell is unpleasant? So the first thing, going back to what can you actually taste out of the sweet, sour, salty, bitter, and umami, you know, can you taste anything? Can you only taste some, you know, a sweetness all the time or a saltiness all the time? Or is it a horrible taste in your mouth all the time? You know, what's actually going on there? And if it's a positive experience, is there anything we can do to dial that up for you? So that would be where I would start. Now, sometimes we need to be quite strategic in terms of balancing out certain tastes, and the chefs of the world are very skilled in this area. So I actually got this off the Cordon Bleu website for the chef school in Paris. You know, so if something is too bitter or too sour, we would balance that by adding some sweetness to it. If something is too bitter, like vegetables often, sometimes adding a bit of salt to it can also counteract that, you know, which is why maybe we'd put, you know, honey glaze on certain vegetables, or we would add salt to our vegetables because it kind of balances those two flavors out. We know that if something is too sweet or there's too much heat associated with it, adding a bit of vinegar or citrus or something sour can sometimes be helpful. And as Carl was mentioning earlier, sometimes we need to focus on umami, and it's not something that for sure in the UK that we spend a lot of time focusing on, but instead of adding more and more and more salt and sugar to food, then sometimes it's more helpful to add a little bit of sugar and salt, but then add some umami to it, which then enhances the salt and sugar that's already there. So examples of umami-rich foods would be, I mean, there's many. I've highlighted in yellow the ones that are most popular with my clients. Marmite is a winner. It's you either love it or hate it, but it can be very effective if you're trying to add more umami. Some clients like mushrooms and things, oyster sauce, Parmesan cheese, tomatoes. There's a whole list there if that would be helpful for you. Now, if taste is maybe not there at all, then we need to focus on some of the other senses. So as Carl was saying earlier, you know, what does the visual presentation of your food look like? I would most certainly prefer to eat the meal on the right as opposed to the left, because we eat with our eyes, right? What about the sound of food? You know, do you have crunchy things, you know, Rice Krispies, carrots, celery, etc., you know, in the meal? Can you hear the sound of onions sizzling? Some people will play the sound of bubbles when they're drinking something bubbly because it makes it feel more bubbly. You know, I've been to restaurants where I've listened to the sound of the ocean when I was having seafood, and it made the seafood taste saltier when I listened to the sound of the ocean than when I didn't, even though the actual salt content of the meal didn't change. If you're able to smell, what can you smell? You know, is your smell impaired? Do you not have any smell at all? Is it a, you know, a terrible smell that you have experienced? What's going on there? If it's a positive experience for you, can we dial it up? And we would certainly use a lot more fresh herbs in particular, much more so than dried. You get a much better flavor experience with fresh herbs. Can we add things like cloves, cinnamon, other forms of spices, for example? But for my particular clients, the compensation strategies that they seem to most enjoy are anything that stimulate the trigeminal nerve of the tongue, you know, so the feeling sensation in the mouth. And these are things like the texture of food, crunchy foods in particular, breadsticks, crackers, those types of things are incredibly popular. The temperature contrast of foods, having something really hot with something really cold. So a hot porridge with a cold banana on it, or cold yogurt with a hot curry, for example. Many clients will add condiments to food that have tongue-tingling properties, you know, hot sauce, horseradish, mustard, menthol, vinegar, for example. Some clients prefer the dry sensation of the tongue that comes from astringency, that sensation you get from having dry white wine, rhubarb, green bananas, the skin of black grapes, for example. And in other clients, they really love carbonation. That is one thing that many clients seem to gravitate towards, even if they don't have a good understanding of taste and smell. They just know, I like the cold, I like the bubbles, and I like the sweetness. And so they tend to have a lot of fizzy drinks. So if we're trying to make, their diet a little bit more nutritious, we'll maybe focus on sparkling water. We'll maybe focus on adding some sugar-free cordial to it, or some diluted pure fruit juice or something to it. So they still get that same sensory experience, but in a slightly more nutritious way. So my suggestion would be to keep an experimental mindset. One thing that works today may not work tomorrow. One thing that works for your friend may not work for you. So it's something that you constantly need to be chipping away at, trying different things, see if you can tweak your own recipes to make them perfect for your experience. It's also worth thinking about whether this would be an opportunity to maybe eat some foods that you weren't able to eat previously. Maybe you hated the smell of fish, but now that your smell sensation isn't as strong, maybe you don't mind it now. Is this an opportunity for you to try some foods that maybe you didn't have previously? Other strategies that would use, sometimes people just can't face a meal anymore, so they'll focus more on healthy snacks, which is fine. Other clients tend to prefer something like a meal replacement supplement, something like Huel or oral nutrition supplements. For clients that are struggling with being overweight, we may focus more on multivitamin and mineral supplements combined with some kind of protein shake to ensure their nutrient needs are met. Some clients prefer to go to buffets because they can try lots of different things without having to go to all the hassle and effort of preparing it themselves. Most certainly look into referrals, either through the NHS or privately, to a dietitian or a psychologist if you think that they may be helpful and they can provide some more personalized advice for you. And also, if it's been a long time that you haven't been able to eat nutritiously, certainly see the GP for some blood tests to screen out for common nutrient deficiencies. Now, if you're somebody that has kind of a constant terrible smell or terrible taste in your mouth all the time, sometimes instead of dialing things up, we need to dial things down. And in those cases, sometimes people prefer plain foods because anything more than that is just not a good experience for them. So plain rice, plain pasta, plain potatoes, etc. Sometimes they choose cold foods because cold foods have a very low odor to them, so minimal flavor. So they'll have sandwiches or cereal or those types of things. Some clients prefer to drink through a straw or use a travel mug, so they're just completely separated from any odor. Some prefer plastic or ceramic cutlery instead of metal cutlery because if they have a metallic taste in their mouth, eating with metal is just not a good experience. As I was saying before, in terms of balancing things out, things like citrus fruit, pineapple, pickles, and vinegar can sometimes be used to match other tastes. Certainly stop smoking because smoking can impair your taste and smell, in addition to what is already going on for you. And certainly be vigilant with oral hygiene because you don't want any kind of bacteria in your mouth kind of contributing to the problem that you already have. And I will now hand it over to Deborah, who will expand more on some of the experience that her patients have.
So my name's Debs. I'm one of the dietitians. I work at Torbay Hospital in South Devon, and I look after people who've had treatment for head and neck cancer. I'm also the dietitian on our intensive care unit. So between the two of those, we were seeing significant problems with people's perception of taste. And so we set up a clinic, which was something new to us. We hadn't had access to a clinic for looking after people with issues with their taste before. So because of the group of people that I look after, we see slightly different issues with taste. Most of the people we look after have had chemotherapy, radiotherapy, or surgery for head and neck cancer, and this can have catastrophic effects on their perception of taste. So we see issues, as Professor Philpott mentioned, with surgery, specifically tonsillectomies, laryngectomies, and any surgery that's affected nerves, and that can have lead to problems with their taste. We also use lots of medications, which, especially in intensive care, which can lead to dry mouth, and lots of our patients are taking antidepressant medications. As a consequence of the radiotherapy, we see issues with the quality and the quantity of the saliva, and this can lead to issues with the people's perception of taste. So we see as the radiotherapy reduces both the volume and the quality of saliva that's produced in people, and they often get very thick, sticky secretions. And with that, you get a reduction of the enzyme that breaks down, of amylase, that breaks down the carbohydrate part of food, which can leave food feeling like wallpaper paste in people's mouths. This also makes the bolus very sticky and difficult to swallow, and people feel like they're constantly trying to clear their mouth. This makes it really unpleasant trying to eat normal foods, and we get people often relying just on nutritional supplement drinks or being dependent on feeding tubes just because the feeling of food residue in their mouth is so uncomfortable. The chewing and thorough mastication releases tastant molecules from the food, and that increases saliva. But if we've had damage to the salivary glands, you don't get that release of these molecules. So we talk in our clinics about ways to try and increase saliva production. So we have an excellent acupuncture clinic, which has been running for about 20 years now, which has shown to be really useful for lots of our patients, increasing their saliva production. In addition to this, we teach people to massage different parts of their face to help with the production of saliva, and we use xylitol mints as they can help freshen the mouth and stimulate saliva production. And there's a little tiny sort of tabs that are called xylomelts. Some people get unwell with putting those in their mouth. They work particularly well overnight. They tend to be less effective during the day, but they can help with a dry mouth. We try and think about the temperature of foods and how this is affecting people, the feeling of the bolus in people's mouths. So fat requires warmth to melt it. And so if you've got harder fat things in your mouth, you've got less chance of warming and melting the fat to allow some of the transfer of flavours. So some people find that having a warm drink with their food can help melt the fat slightly and give better perception of taste. This can also help to clear the mouth, along with carbonated drinks, as Sheri just mentioned. We do note, as Jo said, that temperature is really specific to the person. Sometimes very cold drinks are just too intense, particularly after they've very sensitive mouth after radiotherapy, and so we adjust the temperature of things. Often people have a lukewarm cup of tea or coffee as one of the first foods that they might start with after they've had a period of not eating and drinking. Thinking about the fat and carbohydrate content of meals, particularly if people have got a dry mouth, and I often use things like vegan pesto to suggest to add flavour to foods, because the fat helps with the lubrication, particularly if people are trying to eat food like chicken, which can be very dry right the way through it. Chopping it finely and adding pesto can really help with that. We look at adjusting temperature of food, and as you'll know, if you've tried to make orange juice lollies, you drink orange juice and it tastes really nice. When you freeze it and try and make a lolly out of it, it tastes really bitter, almost as if it hasn't got any flavour to it at all. So if people's food is tasting too sweet, which can be a problem after they've had radiotherapy, we suggest they have things very cold, and similarly warming things up slightly can also change how they perceive the taste. And just thinking about serving food on a very thick hot plate initially, with the people that I look after, their eating and drinking is very slow and can be laboured event, and people run out of saliva after a couple of mouthfuls of food. At this point, we'd encourage them to take a pause, maybe have a sip of water, do some massage of their salivary glands, and then try again. But this process can mean that food goes cold and the starch in it can start to set. It can feel really gloopy and thick. That often leads to frustration and people not wanting to finish their meals. So we do some taste testing, like Professor Philpott mentioned, and we have a look at which of the flavours people specifically are missing or able to perceive. And this is using the protocol from the taste trial, which was done by Julia von Gunther in Germany. And their recommendations with that trial were, if people are struggling to taste bitter flavours, then to get them to drink tonic water, coffee, black tea, green tea, and try radicchio lettuce to try and encourage perception of taste. The people that I I look after in a slightly different position to majority of people with disorders, because we expect a level of recoverability, and as part of the consent process, when you consent someone for chemotherapy and radiotherapy for head and neck cancer, taste changes is one of those expected side effects, and so we expect it to come back. It's just time. It can take a really long time for these things to recover. So if people are struggling with sour, with not being able to taste sour, which is an important flavour if we're thinking about the composition of foods, then we get people to try citrus fruit or things like lemon, being very careful with teeth and making sure that they are looking after the teeth carefully to avoid decay. And if people are struggling with perception of sweet, then as Professor Philpott mentioned, we use vanilla, as the smell of it encourages people to think things are tasting sweeter. And then for salty, Sheri mentioned about people adding lots of salt. We try and encourage, for just general health, not adding too much salt, but sucking on salty pretzel sticks. And this can just help gradually, encourage the perception of salty foods to come back. And then umami, we use umami pastes. There's like a taste bomb, which is a mixture of anchovies and olives and capers, which can be really useful for adding savoury foods. As part of the taste trial, they also did something called oil pulling, which is slightly unusual. So they used 10 mils of an oil that you don't mind the smell of normally, or the taste, and you hold it in your mouth for up to 20 minutes, and they think that helps with cleansing the mouth in a different way to brushing your teeth. And that's got limited evidence and is more of a traditional use, but we've had really good success with it. Initially you think that that's going to be really oily in your mouth, but after a few minutes you find that it turns into a milky liquid, and when you spit it out, you can see there's not really any trace of oil there. And the other thing the taste trial suggests is using lemon and clove oil as essential oils and smelling those for about 15 seconds twice each day. And that's thought to improve the olfactory bulb function. Thank you. And the last slide says, any questions?
Thank you, which is really timely. Thank you very much. So we only have 10 minutes left really for questions. So I'd like to thank you all for giving really clear presentations. The content of what you've been saying is really, really helpful, and we'll make sure that people can see your slides clearly, Debs, in the recording. Okay, so what we'll do is we'll just take some questions now. I'm going to just pull out the main ones for each of you. Most of them actually are for Carl. For some reason. So a couple of people have asked if they could have a copy of your slides, Carl, but what we'll do, the slides will be in the recording, so they won't be separate. People will get them in the recording with all the other information. So just to make that clear. A question from Stuart: why has my GP not recommended blood tests? And just to add to that, Carl, could you just advise GPs on what you would recommend that they do with patients, especially when there's long waiting lists to see consultants? Thank you.
Yeah, I think it's very difficult for GPs because they won't have the expertise in managing sort of the details of true taste disorders, and therefore it's probably not realistically within their remit to organise blood tests unless they think there's a specific thing from the patient's history which would be relevant to test for. And I think the reality is trying to sort of educate GPs around that is challenging. I think sort of on a wider note, obviously our key sort of thing is to try and educate medical students more widely about these issues, so that the what I call the stem cells of doctors are better educated at the beginning, and they become aware of these problems earlier on and think about them more deeply. But yeah, I mean, ultimately, it's a taste problem needs to be kind of checked out by a specialist to sort of understand what it is going on. And because for the reasons I mentioned, obviously to have testing to understand is it a taste problem, is it a smell problem, is it a bit of both, and what the cause of that is, and the blood test may be relevant depending on sort of how that pans out.
Okay, thank you. Question from Omid: is there a relation between HbA1c in type 1 diabetes and taste disorders?
Well, HbA1c is just a means of kind of measuring diabetes. It's often used by endocrine sort of doctors to look at sort of how well patients are doing with sort of blood glucose monitoring. over time, so it gives an indication of how well controlled diabetes is. So in it itself is just more of a measure of diabetes than it is rather specific to anything to do with taste. But obviously poorly managed diabetes can have manifestations for smell, taste, and lots of neurological issues.
Thank you. So there's a couple of people who've mentioned this really. I lost my sense of smell and taste over approximately 20 operations in this case from Sarah to remove nasal polyps. The operations were carried out over a period of 40 years. I suffer from asthma as well. And she's recently been granted the DMARD drug to help with that. So she's sure her sense of taste is returning slowly. However, not my sense of smell. Is this possible?
Well, if the underlying problem is chronic rhinosinusitis with nasal polyps, that's almost invariably a smell problem, not a taste problem. And you know, once the condition is better treated, and if you're on a biologic medication that is likely to be beneficial to that, then your retronasal olfaction, which is the sense of smell that you get when you're eating, is likely to sort of improve slowly. Now, you know, polyps in the nasal cavity can grow in different places, and they can block smell coming from the front of the nose. They also block smells coming from the back of the nose, and depending on exactly how big they are and where they are in the nasal cavity can influence that. So it can vary from one person to the next. Often patients with sinus disease get fluctuations in their flavour perception because of the dynamics of the nasal airflow and how polyps can vary from day to day, and how the amount of swelling in the nose can vary from day to day. Also, often a lot of mucus there as well, which can contribute to that. So, but it's almost invariably a smell problem, not a taste problem.
Thank you. Okay. There is a question here from Naomi about her daughter who actually has congenital anosmia. She was born with the absence of olfactory bulbs. This is something we can help with. If you email me Naomi to the information email address, I'll be able to help you with that. But they're just attempting to understand the impact on her taste. Carl, I wonder if you could just very briefly, just because people have asked about the Skittle test as well, could you just give a brief overview of that, please? Okay.
Yeah, I mean, absence of olfactory bulbs is what we call congenital anosmia, and that's not a taste problem, it's a smell problem. So in theory, the taste pathway should be intact and working normally. I mean, obviously a taste test would sort of confirm that, but I've not come across cases of congenital anosmia where the olfactory bulbs are missing that can also associated with loss of taste as well. So I would expect true taste to be present.
Thank you. And the Skittle test, just briefly,
the Skittle test, yeah. Well, a good way to demonstrate the separation between smell and taste is to take a sort of a fruit flavored sweet like a Skittle or a wine gum or a jelly bean, and pinch your nose, pop it in your mouth, let it sit there for a sort of 10-20 seconds, let it dissolve. Think about what you're experiencing. The most likely thing is you'll just get sweet. You won't get any flavor of what the sweet is. So if you're looking on the outside and it says a green sweet, you're going to maybe anticipating an apple flavor. If you pinch your nose and put it in your mouth, you won't be able to detect apple at all. You'll just get sweet. And as soon as you release the fingers from your nose and let the air flow through your nose again, then you'll be able to tell that whatever fruit flavor it is, so whether it be apple, strawberry, banana, etc. So that's a good way to demonstrate the difference between smell and taste.
Thank you. That's really helpful. That's a lot of people have asked about that. Someone mentioning that they have a soapy taste that drives them crackers. They completely lost their sense of smell for 8 months, and they're just wondering if this soapy taste is something that's common.
That sounds like it might be a complicated scenario, which is maybe a combination of a smell issue and perhaps a distortion of taste as well. That sounds like it's definitely one that needs mapping out with smell and taste testing in parallel to sort of understand where the problem lies and where the treatment should follow.
Thank you. A couple just on treatments. Someone who says they've been taking Zomig for sleep. Could this be the cause of his taste loss, presumably?
Without looking in the BNF, I mean, obviously, as you saw from my side, there's a huge list of medications. So normally I would look it up in the formulary guidance and see if it's listed there, and if it is listed, and even, I mean, to be honest, even if it's not listed, the thing to do is to try stopping it for a period of a few weeks, and if you feel that the problem's gone as a result of not taking it, then the likelihood is it may well be a causative factor.
Thank you. And if some people are unsure whether their medication could be a factor, they could ask a pharmacist, couldn't they?
They could ask a pharmacist, yeah,
Yeah.
because obviously a pharmacist might have a good idea of the things that might sort of cause the issues. Yeah, I mean, they'll be able to look up obviously some potential side effects in the British National Formulary.
Thank you. Does alpha lipoic acid help?
I mean, it's one of these that's been sort of tried in a kind of a small scale study that suggested might help. One of the things about it is that it's something you can buy over the counter and unlikely to cause any significant harm from taking it. So it's probably something that people might choose to try depending on the cause of their problem. So again, it's one of those where it's been suggested for people who have no apparent cause for the loss of taste.
Thank you. And has there been any research done on the influence of hormonal fluctuations on smell and taste?
No, I've just written that into a grant application. That's something we might look at. So the jury's out on that one.
Thank you. Brilliant. Okay. Now, there's just a couple of others really. I don't quite understand the question, but you might understand it better than me, Carl. Are there any ways in order to reduce our taste threshold? I think it's where someone's finding taste difficult, overwhelming, maybe.
I mean, that would come back to it if true taste disturbance that we now call paragusia is the issue, then using the medications I was mentioning about, like amitriptyline and gabapentin, may be helpful medications to talk to patients about using, which is basically kind of blocking the nerve signal essentially.
Thank you. Is the correlation between the gut biome and sensory loss?
That's another thing I've just written in my grant application, so I don't know yet. I need to do the research.
Fantastic, thank you. So we're getting to the point really where there are a few more questions. Some of them are very specific. Someone from Canada are asking some information. I can help you with that if you email in. That's probably the best way to handle some of these questions. So anyone who hasn't had a question asked or answered in this part of the Q&A, if you want me to get back to you on that, I can do. All three of our speakers have also said that they would be willing, if we have any specific questions that we can't answer, they'll try and help us. And what we might do is produce a kind of frequently asked questions piece that would be helpful to share with people. There's so many different questions, aren't there, to be addressed. So what I'd like to do is, there is one question for Sheri really. Someone saying, I've tried most, if not all, of your approaches over the last 2 to 3 years of my sensory loss. Are there any naturopathic approaches I can take from here today?
I'm not aware of any. Debs, are you aware of any that might work?
No, just the alternative option of acupuncture we found is really effective if people do have saliva issues.
Okay, thank you. That's really helpful. I'll ask you a bit more about that at some point. That would be great. Okay, so we're at that point really where we need to draw this part of the event to a close. So just bear with me because I'm looking at the questions at the moment. Throughout the presentations, Sally particularly has been busy dropping lots of useful links into the chat. Some of those links are ones that Sheri and Debs have suggested that be good sources of information depending on the underlying cause really. So what I'd like to do then is just share a few notices really. So this is the last of our 2024 series for patients and professionals. We will be evaluating this programme in December based on the feedback from people who've attended. So please complete the survey. I think Sally may have already dropped it into the chat and certainly will do now. So the survey that'll help us to understand what we did well and what we can do better. We're always learning and it'll just inform how we run future events. We didn't really properly mention the support. So when Jo was talking, she mentioned about the ENT consultant referring her to Fifth Sense as a source of information and support. So we run online events called Let's Talk Smell and Taste events. These are support groups for people with various what we call OSMERs. We will be relaunching them next year, probably with much easier titles, ones that say what it says on the tin really, whether it's about smell loss or smell distortion or smell and taste distortion together. So we will be relaunching all of that when we've talked to our co-hosts, our volunteers who are helping us to run those groups next year. So the titles will just better reflect who they're aimed at. So there will be further announcements on that in our Christmas newsletter. We will be uploading a recording of this event onto our YouTube channel. We'll be adding captions and a transcript to make it more accessible for people. So please bear with us. That takes us a bit of time to do. We hope to get that up there within the next week or so, possibly up to 2 weeks, depending on how busy we are. If you've gained value from attending or watching the recording of this event, please consider making a donation to help us continue our vital work. That's always really helpful for us. We make all of our events free, but we are very appreciative of any donations that help us to continue this work. Now, I'd just like to hand over to Sally, who's wants to talk a bit about a festive fundraiser that we have at the moment and some other events that are going on. Thanks, Sally.
Hi, yes, I was going to show a presentation, but I can't find it now, so I shall just talk it through. So one of our wonderful volunteers, Jimmy Harrison, has created some really fantastic Christmas gifts, especially for Fifth Sense. So they're themed to smell and taste. We've got some digital images that you can use as a kind of e-card and send them. You can use them on your social media or send them via email to your friends and family. There's also some limited edition hand printed cards as well of a similar design, some coasters, some really beautiful coasters, and also a one-off limited edition framed print. So they are on the Etsy site. I'm going to pop the link to where you can purchase them. And all proceeds goes direct to Fifth Sense for those items. It's just postage and Etsy fees that need to come out. But apart from that, all donations go to Fifth Sense. So I really do suggest that you have a look at his Etsy site for those products. Hopefully, if you're a Fifth Sense member, you should have received an email and you might have seen them already, but they really are lovely. And then secondly, I just wanted to talk about the Birmingham meetup. So if any of you are in the Birmingham area, we have a special meetup next week, next Wednesday, where you can meet other people in person who've got smell or taste disorders. So it's just a really great chance to get together with others and have that sort of sense of community and connection. So we're meeting next Wednesday, 10:30 to 12:30 on Temple Row. So again, I'm going to put the link in the chat so you can book your ticket. We haven't got many places left, but there are a few. So if you're in the Birmingham area and you'd like to come along and meet Fifth Sense staff, volunteers, and other people living with the conditions, then do come along to that. And then just the final one is, if you are interested in volunteering, we couldn't do events like this without our volunteers and our supporters. We're always really keen to hear from Fifth Sense members and supporters that might like to help us with our work. So do email me in if you think you might like to help us. Thank you. Thanks, Mags.
Thanks, Sally. Brilliant. Okay, and just if you're not already a member of Fifth Sense, if you'd like to join us as a member or supporter, you will then receive newsletters telling you about all the work that we're doing and the events that we're running. So you'll have priority to those events. There's links in the chat on how to join Fifth Sense and receive those updates. So it's only left me now really to thank all of our guest speakers. So Carl, Sheri, Debs and Joe. Your presentations have been so helpful. We've had some lovely messages in the chat now, thanking you really for such a wonderfully detailed and useful session. So we know that there's going to be some really helpful content for us moving forward. I'd like to thank everyone who's attended as well. It's been lovely that you've attended this event and supported us, and we're here to help you. So if there's anything else we can help you with, do email in to information@fifthsense.org.uk. Thank you very much. the link in the chat, if you haven't already picked that up, if you could pick that up now so that when we close the session, you don't lose it. We will send a follow-up email out to people, so you've got that link again if you need it tomorrow. Okay, thank you very much and good night.